Good morning, everyone. I can see persons joining still. Good morning. Welcome to today's online discussion on dementia in the midst of the COVID-19 pandemic, challenges and solutions to the prevention of elder abuse. I want to take this opportunity to say thank you for joining the Barbados Alzheimer's Association and friends in this endeavor to raise awareness about dementia and elder abuse in the unique context of COVID-19 pandemic. Before the discussion gets started, I would like to invite Ms. Pamelia Brereton. She is the president of the Barbados Alzheimer's Association and also one of the panelists that you would hear from later. I want to invite her to pay tribute to Barbadian icon and beloved patron of the Barbados Alzheimer's Association, Dame Patricia Simmons, who passed away on May 27, 2020 at the age of 94. Pamelia, over to you.
Thank you. Good morning, everyone. First, let me say, Senator Dame Patricia Simmons. She was our patron. Dame Patricia was an absolutely beautiful lady. And she had lots of charm, lots of grace. She had commanded the English languages so well. When I first met her, we became friends instantly. She was an educator. She was principal of St. Michael's School, and she was a politician. She was a stalwart, she was a senator, she was a stalwart in the political arena. And there are many students that Dame Patricia had taught that became members of BAA. But what is important to understand is that she supported the organization so well. She was the type of person that would call me frequently, and we would have many conversations at night on the telephone in respect to the association. We both look forward to those conversations nightly. However, she was on hand anytime we called her. She was there to present certificates to persons, as you can see in the picture on the screen. The persons who would have taken part in our participation programs. She also attended our Forget-Me-Not balls and was on hand to give out presentations whenever necessary. One thing I do know is that she had the BAA interest in her heart. And we at the BAA really appreciate having her on board. Dame Patricia is the kind of person that we respected and I admired, even though for myself, I didn't grow up here. But when I met her, she, being an educator, educated me about Barbados, because there are a lot of things that I never knew because I left Barbados so young. But I knew I could count on her for it, telling me the different things that would happen, even the things that happen in the rum shop, would you believe it or not? She would talk to me about those kind of things. When she realized that I had a background in art history, she thought, well, look, you're going to have to come over and have tea, because I believe she has some art pieces and so on she wanted to talk about. However, Dame Patricia, your memories will live on with us forever, especially when we look back at the pictures that we've had over the past few years. I'm sure all the members of the BAA will agree with what I'm saying. So at this time, I'm going to say, Dame Patricia, wherever you are, we at the BAA say thank you, and may God bless your soul. There you go.
Thank you, Pamelia, for that beautiful tribute to the BAA's patron, Dame Patricia Simmons. At this moment, I'm just going to extend again a warm welcome to those who have joined since we've begun. Today, we will be discussing dementia in the midst of the COVID-19 pandemic, challenges and solutions to the prevention of elder abuse. The session is being recorded, so it should be available online later for those who can't make it. Now, just for a bit of context to today's discussion, June 15th, that is this coming Monday, is recognized worldwide as World Elder Abuse Awareness Day. The world, as we know, is seeing a substantial growth in the number of older persons. In fact, the UN estimates that between 2019 and 2030, the number of persons over the age of 60 years will grow by 38%. That's significant. And with that projection, elder abuse, which is already was estimated in 2017 to be 1 in every 6 older persons, is also expected to rise. People living with dementia and other forms of cognitive impairment have a heightened risk of abuse, especially because they tend to have challenges understanding or even reporting the abuse meted out to them. And then COVID-19 struck us. This pandemic has resulted in already vulnerable older persons being significantly more at risk of mortality and severe illness following infection of COVID-19. The COVID-19 lockdowns and restrictions to visits to nursing homes, daycare facilities for older persons, and it also caused a heightened dependency of older persons on others. It's all a recipe for increasing levels of elder abuse. This is why today's discussion is so pertinent. Dementia in the midst of the COVID-19 pandemic, challenges and solutions to the prevention of elder abuse. And to help us break down that mouthful of a topic, we have with us our panelists who I would like to introduce now to you. We have Dr. Ambrose Ramsay on the line. He's geriatrician and consultant to the Barbados Alzheimer's Association. You'll be hearing from him in quick succession. We also have on the line Dr. Belle, psychiatrist, and also the vice president and consultant to the Barbados Alzheimer's Association. We have joining us from the UK, Mr. Chris Lynch, Deputy CEO and Director of Policy, Communications and Publications for Alzheimer's Disease International. We're grateful to have him online as well. We have with us Ms. Colleen Walcott from the National Assistance Board. She's the assistant there, and we are extremely grateful to have her on the line as well to chat with us. And of course, Ms. Pamelia Brereton, whom you heard from earlier. So without further ado, we will be commencing the discussion. We're going to begin with Dr. Ramsay. However, I want to invite our audience to feel free to ask questions throughout the discussion. You can use the Q&A box. It should be at the bottom of your screen. You can type your questions in there. I'll pick them up for when we come to the Q&A discussion, Q&A segment at the end. So without further ado, Dr. Ramsay, I'm going to hand over to you. Please unmute your mic.
Hello, good morning, panelists, Kimberley panelists, and persons from around the Caribbean and around the world joining us in this discussion on dementia and COVID-19 and also elder abuse. It's a tall order, but what I will try to do briefly is just briefly speak about dementia and COVID-19 and the nexus that it has thrown us into. Now, first I will start talking about dementia, which is a group of illnesses which tend to affect the memory and then eventually results in loss of function, which is the person's capability to perform self-care. And over time, results in the individual requiring assistance from others. And this is where the caregivers come in. And it requires a lot of demands are placed on the caregivers depending on the individual. You can have the sweetest person with dementia who poses really very little challenge in providing for the care provider and providing care. And then you can have an individual at the other end of the spectrum who's the most difficult person to care for, someone who wouldn't sleep, who's always on the move, who's always pulling down the house, etc. So dementia in itself presents a complex illness, especially when you also have to deal with chronic diseases. Many persons with dementia also suffer with the chronic non-communicable diseases like hypertension and diabetes, heart disease, and others. So it makes it very difficult for the caregiver in particular to try to assist these persons to maintain their health, hygiene, to stay safe, etc. Then you have COVID-19, which has come around, an aggressive viral illness which has proven deadly to many of particularly the older persons around the world, which also requires as a significant intervention to prevent spread, social distancing or physical distancing is the term that's most appropriate now. And also, other complex matters like hand hygiene, cough and respiratory etiquette, and the use of face masks, which can be very difficult to someone who is living with dementia to understand why they need to, why they can't have a hug, or, why the person is now, especially if it's not a close caregiver in the same household, why they have to be so far away from them, why they cannot touch, why they now have to be dealt with either through a window, communicated through a window, or if when this person comes into the room, they're all covered with personal protective equipment, which, completely masks, the individual. So here you have, how do you get someone that's living with dementia to accept all of this? And of course, quite often they don't. So we have a challenging situation here, and it'd be interesting to hear from you all and others who are joining us as to how we could go about continuing to provide what would be considered necessary in helping persons living with dementia to be healthy, to be safe, and also to provide that much needed social interaction, which is now kind of taboo in this age of COVID-19. So, the isolation procedures are important, good for the coronavirus and protecting our population from getting the virus, and it's also good in protecting in keeping and there are also measures that are useful in taking care of the individual who's suffering with the virus, but it's really bad for dementia. So I've seen, and I do suspect also, I've seen reports from around the world as well. Persons living with dementia are taking a significant hit from this pandemic, and they're suffering. So it'd be good to hear, from the other panelists as to how we can go about addressing, countervailing these effects. And then, of course, you have abuse, and as Kimberley mentioned, this environment is, I guess, ideal for, let's say, for abuse to occur. I shouldn't say promoting abuse. I don't want to say promoting, but it's the ideal situation, or it creates a situation where persons who have to, let's say, care for older persons with dementia, more likely to find themselves abusing these older persons. And one thing I can say about abuse, elder abuse, before I end, is that many people who perpetrate, or you know, who perpetrate elder abuse are not aware of what they're doing. There are lots of persons out there who don't understand what elder abuse is, and they quite often consider what they're doing as normal practice, as acceptable practice. And I will end here at this point. Okay, thank you.
Thank you, Dr. Ramsay. Very interesting comments there, especially the last one about the persons not realizing that they're actually engaging in elder abuse. To continue the discussion, I want to invite Dr. Belle to the microphone because I want her to continue regarding the mental aspects of abuse, and especially in this COVID-19 era. I am seeing questions coming in, and some of them we will address as we go through the presentations. So continue to post your questions and we will address them in due course. Thank you to our audience, and Dr. Belle, over to you now.
Thank you, Kimberley, Madam Chair. I'm just going to take the opportunity to say how glad I am that the Alzheimer's Association, with the energy of Ms. Brereton, was able to get this meeting together for us to participate in this panel discussion and to address dementia in the midst of the COVID-19 pandemic and the solutions to the prevention of elder abuse. Now, as Dr. Ramsay would have said, elder abuse is not a new issue, and hence the reason why we have June as Elder Abuse Month and the 15th of June as World Elder Abuse Awareness Day. And I think it's important for you, well, hacking something out of mid-air, that it is something that every year happens, and we want to make sure that people understand about both the dementia and elder abuse, and of course in this climate, the COVID pandemic. The elderly, and who really are a large proportion of our societies across the world, are a group of individuals who, apart from doing the inevitable, which is getting older, also are a group of persons who find themselves with various illnesses, mainly non-communicable diseases, which create a definite burden to these individuals. These illnesses cause physical and psychological problems. Some of these problems, which are well known, are involving the major body systems such as cardiovascular, vascular, and neurological. Some of the conditions which produce disability in the elderly are things like diabetes, hypertension, dementia, and arthritis. Behaviors exhibited by elderly individuals and those around them can occur based on the degree of disability the individual is suffering, as well as disability will have on the functioning of those around them, particularly their caregivers. One of the early issues of the elderly individual who may still be under the age of retirement, because we're seeing that elderly is being called 60. Now, I am way over that and I don't feel that old yet. But we say that 60 is kind of that age, and some of these people are still working. And you'll be surprised that in that environment, there are people who actually are abused, because there are some people who are younger and they feel that these old people are blocking their promotion, too slow with learning new technologies, and if perchance they forget to do something and it causes some disruption in the production in the workplace, then they may be insulted and they may be called demented and stupid and, you know, all kinds of names that are very non-complimentary. And all of that constitutes emotional abuse. Emotional abuse is actually the most common form of abuse suffered by the elderly. It doesn't show on the surface, but physical or sexual abuse may leave bruising, scars, or some outward evidence. So we really have to be afraid of abuse in general, but emotional abuse in particular, because it doesn't show, as I said, on the outside. Now, in what circumstances does elder abuse occur? And you know, the senior homes, the elder care homes, whatever you want to call them, nursing homes, hospitals, all the places where the elderly may have to go for one reason or the other. Elder abuse may occur in public places where other people are waiting in lines, etc. An elder person may appear to be hindering the advancement, like in the bank. And of course, this causes people to think that they're being kept back, and they may actually abuse these older people without concern for the fact that they might be a little bit slower because they're aging. However, it must be noted that this form of abuse can occur in the case of individuals who are being even looked after in their homes. So what causes, out of all that I've said before, the development of mental health issues in these situations? And of course, one of the big ones is losing one's independence. And then you have being made to feel unnecessary and a burden, having life regulated by others when you still have the capacity to some extent in doing things for yourself, being physically manhandled, being verbally abused and harassed, and being unable to manage your own, even though you still have some capacity if you're not really demented. You might just be Asian but not demented. So how are the mental health symptoms manifested? And they're no different from in other situations of mental health. But one of the things that we always remind people of is the degree of loneliness which may occur in the situation of the elderly. You're up and about and out and doing things one day, and the next day you're home sitting down and people are leaving home. Everybody maybe with a radio and maybe with a telephone call here and there, but particularly not in the run-of-the-mill everyday fray that you were in before. And so loneliness is a big part of what we are talking about today. And out of loneliness may come anger, which goes on to depression, and in some cases, even psychosis. And of course, in a situation where you are at the stage where you need probably somebody to come in and look after you. And Dr. Ramsay just mentioned that some of these people may cause some stress to the persons who are elderly in some situations, and they might not be even aware of the fact that they're causing that stress. You may have the elderly showing signs of fear. You may even express the desire to die, which is really an end stage kind of problem. And we hope not to have things reach that stage. What can we do about this? Better education of those who become caregivers, introducing the issues of aging to children from the very educating the overall society to appreciate that we all have to age and to appreciate the contributions that older persons have made to the society. We just heard Pamelia give a very nice tribute to Dame Patricia, our former patron, and those are the kinds of people that we have to emulate and introduce younger persons to. Within the COVID-19 pandemic, the loneliness may even become worse. And you've heard about all of the situations that have been happening abroad. We haven't had much of that impact, thank goodness, from in the situations that others have had overseas, where people are just accustomed to going to visiting their relatives. Now there's been the shutdown, we've had a shutdown, so that pertains. But then somebody dies and you haven't had time to even say goodbye. They haven't had time to say goodbye to you. All they've had is the loneliness of knowing that somebody used to come, but they haven't come anymore. Secondary caregivers are often persons who are not able to travel to work as they themselves are vulnerable individuals. A lot of our caregivers are actually older people, and especially in the private sector, more so than in the government sector, I would think, because of the fact that you have an age limit where you have to leave work. But in the private sector, some of the retired nurses, some of people who have done care of the elderly in our situation here in Barbados, these are the people who were the secondary caregivers to our older people and our dementia persons. And those persons then couldn't go and physically isolated. They're on their own in a lot of instances. They became on their own because of the COVID. Relatives did not be able to find a substitute way of handling the care of the elderly, resulting in neglect of these elderly persons. As a consequence, the physical ailments of the elderly may also be neglected. The elderly with dementia may exhibit acting out behaviors, may become moody, and develop anxiety, depression, and psychosis, as well as elderly might, as the well elderly might in the case of COVID-19. So we have the situation where we can see the impact that COVID-19, aging, and elder abuse have on our elderly populations. Caregivers, both primary and secondary, with additional problems as a result of the pandemic, may also become irritable and depressed and act up on the elderly. So we have the caregivers suffering as well during the COVID situation and during the general situation of caring for the elderly, because it is a very, very stressful situation to have to look after persons who may not be able to communicate properly, may not be able to answer to you properly or understand the messages that you're trying to give. So those individuals who have no understanding of the protocols and changes necessary because of COVID-19 become much more difficult to manage. So we need the support for caregivers, primary and secondary, and family members, and all of the people dealing with the elderly in this situation. They need our support. Don't forget that, especially in the new conditions, the new normal, as we so coolly say nowadays. So caregivers and family members must be more tolerant. And I'll close now and let somebody else follow on. Thank you.
Thank you, Dr. Belle. I think it's certainly difficult to talk about all of the abuses possible and the mental impact as well in 6 minutes. It's just, there's just so much happening, and COVID-19 has certainly exacerbated the situation. Right now and thank you again, audience, for your questions. We're going to pick up some of them, especially the financial abuse discussion. We're going to have that later on in the Q&A segment. But right now, I want to turn over to Mr. Chris Lynch. He's going to start to help us to see possible solutions to this problem confronting older persons. What can we do as a society, as government, as civil society? Let's hear from Mr. Chris Lynch now. I'm going to go ahead and share your presentation as well.
Thank you, Kimberley. Hello, everybody. I'm absolutely delighted to be joining you today. I'm based in London at the moment. A really super opportunity to join the panel. Thank you to Dr. Ramsay and Dr. Belle, because what you both have said has kind of teed it up very nicely for me in terms of some of the areas I wanted to cover as well. The presentation that I've put together, I've said to Kimberley and Pamelia that we will skip through some of these slides, but I wanted to include them perhaps for circulation afterwards. So if anybody wants them, just for context, I'm going to do a little bit of an introduction if I could. So Kimberley, could you do the next slide for me? For those of you that aren't familiar with ADA, Alzheimer's Disease International, we were established in 1984. And we're the body that represents now 102 associations and federations around the world. You may be familiar with our World Report, our World Alzheimer Report, and World Alzheimer's Month, which we operate each year, and we're in official relations with the World Health Organization as well. And next slide, please. I wanted to put this slide up just for context, really, and the numbers, and I think Kimberley mentioned this earlier in terms of the growing numbers of people over the age of 65, and I think the forecast for that is approximately 2 billion by 2050. But in terms of dementia, there are 52 million people currently living with dementia in the world, and that figure is set to triple by 2050. An annual cost of US dollars, $1 trillion a year, and that figure itself is set to double. So we just get a sense of the scale of the challenge. And next slide, please. 3 years ago, the World Health Assembly, the WHO launched the Global Action Plan on Dementia, which was the result of 10 years of joint working and advocacy. And I'm going to come back to this a lot because I think that the development of national plans is perhaps the most important thing we can do in terms of looking at not just the preparedness of health and care systems in normal times, but that in times of a pandemic like COVID, the realization it's been exacerbated to the nth degree in terms of how unprepared globally the world has been and what impact that is having on people with, particularly people with dementia. Just something in terms of poignancy, age is obviously the biggest risk factor for dementia, and it's also the biggest risk factor for COVID. And it's a really poignant thing just to keep in mind. Next slide, please. I want to give you a very quick look at this, which is the global map at the moment of national dementia plans. And without going into detail, but you can instantly see the gaps that currently exist right across the globe. And next slide, please. What you see from the chart is that since the global plan was developed, there have been nowhere near enough national dementia plans being brought forward. It is improving. However, what you see from this is that of the 194 WHO member states that have committed to the global plan and have committed to developing a plan, you see how many more we're going to need, the equivalent of 26 new plans every year for the remaining period of the global action plan, which is highly unachievable at the moment. And next slide, please. To give a quick spotlight on the region as well, and you guys will all know this in much better detail than I will. There are a couple of plans in existence, not necessarily being rolled out uniformly across countries, and certainly with some lack of funding as well, but there's definitely some progress and some activity there. Next slide, please. And this particular chart is from a report I'm going to mention at the end called From Plan to Impact. And it's an annual report ADI does reporting on the global plan from the WHO. And this is from last year's 2019. The new one will release in 2 weeks' time. I'm going to invite you all to the online launch of that in a couple of weeks. It's well worth having a look at this table. It gives you a snapshot of where all of the member states and the countries are in terms of developing their plans. Next slide, please, Kimberley. I'm hopeful that a good number of you will have seen and been aware of this, but awareness raising is one of the key areas of that global plan and forms the kind of the foundation, the cornerstone of national plans as well. I mentioned that ADI work with our members across the world for World Alzheimer's Month every year. And last year we worked really closely with PAHO on a specific awareness raising plan. Let's talk about dementia. The real core behind this, or the focus behind this, was to get associations and ministries of health and PAHO country offices working together. And I think with Dr. Claudina Cayetano at PAHO, it's really helped. You know, the relationships have developed a lot during that period. But it is only just the start, so we really want to continue to move forward with some motivation and momentum for it. And next slide, please. Developing a plan, a national plan, I know is often intimidating, particularly at government level, because of the perceived complexity of it, issues around funding, issues around data and research behind it, etc. But WHO produced this really good guide towards a dementia plan, and it is available on their website and our website as well. It's a really handy tool. I'm not going to go into any detail on that, but if you could go to the next slide, it kind of helps bring to life why a national dementia plan is so important. We genuinely believe it's the best strategic planning tool. And that opportunity, I think, now that we have, once we've realized that with COVID, preparedness, healthcare system preparedness is lagging for dementia really poorly right across the world. And when you then leverage in something like COVID, you begin to realize how unprepared the system is, particularly with COVID, because it impacted people, elderly people, much more. And next slide, please. I'm just going to skip through these two, but it was really for information. There are lots of really good resources on our web pages in terms of successful plans, some really good templates in terms of countries that have developed really good, robust plans. But let me, if I can, focus a little bit more on the impact of COVID. As I mentioned, I know it sounds quite odd, but age is the biggest risk factor for COVID-19 and for dementia, and that overlay is really influential in essence, what has been evidence of elder abuse and rights abuse in many countries across the world. Something that we've been really, really keen to communicate and to amplify is that chronological and biological age are absolutely not the same thing. So making blanket decisions to ask people over a certain age to isolate for longer, etc., is a really problematic approach. And as time has gone on, I think the volume of opposition to that has started to come through, particularly from the UN, or poignantly from the UN, And I got to meet the new UN independent expert on aging just a couple of days ago on a meeting this week. Really, really hopeful that she will continue to amplify this message as well. But as the two doctors before me were talking about, the real key areas here of importance, I think, in terms of dementia, but also in terms of elder abuse, are things like disruption to services. Just prior to the call, we were catching up that I think certainly in Barbados, we've been exceptionally good at managing the situation and should be held up as one of the countries that has been successful in doing that as a positive case study. We know that there are lots and lots of examples where that just hasn't been the case. Real simple things like disruption to face-to-face support services for people with dementia, highly important. As Dr. Ramsay was saying, the impacts of isolation, anxiety, the having to daily reinforce recommendations. And then real major impacts on things like delaying diagnosis and disruption to the post-diagnostic pathway. Also to research, to trials, and ultimately we fear to prevalence and incidence rates as well. And then one very, very poignant one. We made a statement about this about 4 or 5 weeks ago. It also was included in our statement to World Health Assembly this year as well, where scarcity of resources has resulted in some absolutely heartbreaking and tragic decisions made around triage, life and death decisions, often not even being made at bedside, being made at roadside, outside people's houses, where paramedics and ambulances couldn't even get people to hospitals to have any form of consultation. Truly heartbreaking stuff. And making those decisions based on age or disease very quickly must be an incredibly difficult thing for healthcare professionals to do, but it is also a rights abuse. And next slide, please. In terms of going forward, one of the things that strikes me most poignantly is how are older people part of the solution and not just being asked to step aside and to shield. And hopefully we'll come back to that as part of this discussion. But I think as Dr. Belle said and reminded us that regardless of age, those people include workers and childminders and voters and carers, the integral members of society, and should not be sidelined just based on a chronological age. Next slide, please. Briefly, ADI has put up some really great resources from all over the world, both on our website, and I know all of our member organizations are doing this as well. Hopefully some of you have been able to join our webinars over the last couple of months. We started with a really poignant piece of work from our member in China, and Dr. Huali Wang. She was on the front line as a medical doctor. She was practicing during the day, during the actual crisis, and then isolating from her family at night. She put this amazing presentation together for us, which is available on the website, which is advice for healthcare professionals in terms of treating people with dementia during the pandemic. Well worth a watch. It's only about 20 minutes, so I'd recommend you do. Next slide, please. And this is my last slide. It was really just to bring your attention to our launch on the 25th of this month of the new edition of From Plan to Impact. So this is our interrogation, really, working with our member associations across the world in terms of how is progress being made to the WHO's Global Action Plan on Dementia. And I think now more importantly than ever, and if I can I just give you a quote from Kate Swaffer. Kate Swaffer is living with dementia. She's the CEO of Dementia Alliance International. Hopefully many of you will have heard of Kate over the last few years. But she said to us the other day that in 2020, the rest of the world suddenly experienced what people with dementia and their families experience on a daily basis after diagnosis, such as isolation, distancing from family and friends, fear, anxiety, and stigma. And we felt like it was incredibly poignant way to sum up this relationship between COVID and dementia. That's it. Thanks so much for allowing me to do the presentation.
Thank you, Chris. Certainly so much there to discuss later on in the Q&A segment. For sure, the dementia plans, I know the Barbados Alzheimer's Association has put together a dementia plan. I was part of that process, and we too are looking forward to seeing it go live because we know the importance of it. I want to turn the mic over now to Ms. Colleen Walcott from the NAB. She's going to tell us a little bit more about the role of the NAB in the fight against elder abuse, dementia, and COVID, those dynamics. So Colleen, over to you.
Thank you, Kimberly. Good morning to our audience. And let me express to the Alzheimer's Association on behalf of National Assistance Board our thanks for including us in today's activity to observe World Elder Abuse Awareness Day. In the next few minutes, what I will do is just touch generally on elder abuse and some of the general challenges. Then I will look at the services of the National Assistance Board, which are delivered in the community to older persons, and then some of the practical things that we would have done during COVID-19 to maintain older persons in the community while at the same time preventing elder abuse. Elder abuse is a global phenomenon, and Barbados, with its aging population, has not been able to escape from the associated challenges and negative impact. Thus, just like other countries around the world, Barbados has over time become aware of the necessity to devote time and resources to address the various facets of elder abuse. And by facets, I refer not only to the types of abuse, but among other things, to the impact on individuals and families, the implications for care of older persons, the costs associated with this care, and also the challenges which we encounter with the reporting, the investigation, and the management of elder abuse. This year, in the midst of the COVID-19 pandemic, Elder Abuse Awareness Day affords us yet another opportunity to raise awareness, identify challenges, and develop solutions for the prevention of elder abuse to older persons, and especially those living with dementia. However, let me state that the issues are not new. What has happened is that the pandemic has exacerbated these issues that older persons are already encountering. Older persons, as we know in the literature and all the reports around the world have said, that older persons are disproportionately affected by COVID-19 due to age and their pre-existing conditions. As a person ages, the risk of having a pre-existing condition such as hypertension, diabetes, and other ailments increases. And this vulnerability places older persons at a higher risk. Now, the National Assistance Board delivers various services to older persons in the community which are aimed at maintaining them in the community and delaying preventing and even delaying institutional care. These services include the home care program, which services over 1,000 clients, the Senior Citizens Village, which provides a housing solution for 38 residents, our elderly care program, which currently serves 30 participants, and the Seniors Recreational Activities Program, which provides stimulating activities for over 400 participants in over 20 centers across the island. There's also a 24-hour emergency shelter for 34 homeless men and transitional shelter for individuals and families who have been displaced. However, that is on a limited basis in terms of the capacity which we can serve there. Now, when the first case of COVID-19 was identified in Barbados, and as the island moved towards a national shutdown, the National Assistance Board, in the interest of safety for older persons, suspended programming in the Seniors Recreational Program and the Elderly Daycare Program. This meant that a lot more persons were spending more time with family, or for those who live alone, they were spending more time on their own. And Dr. Belle would have mentioned about the loneliness and the social isolation which this can cause, and which we know to be very evident. In our elderly daycare program, and this is one of the solutions that we would have, practical solutions which we came up with. In the elderly daycare program, there was a concern that persons may experience an extensive period of isolation while at home. And so therefore, the staff of the daycare center, as a part of their duties, had to maintain contact, either it was on a daily or weekly basis, making frequent telephone contact with these participants and with the families to find out how they were coping and providing any support and psychological support. By contact, now the contact served a dual purpose. It was not only to check up on the participants who were now at home, but also to check on the family members. Very often, these family members would not, and some of these participants would have had early stages of dementia, so they're not at home in the day with their families, some of whom may be working. But now, because of COVID-19, they're all in one environment, and sometimes depending on the number of persons in the household, may be a bit crowded. So checking up serve a dual purpose. You check on the participant, and you also check on families as well and provide any support. Even as we're doing that, we also have to be mindful that as we're providing services for participants and our beneficiaries of our programs, that the National Assistance Board has an aging workforce, many of whom are female, and they have dual role as caregivers. So they're formal caregivers and paid caregivers at the National Assistance Board, but once they go back to their homes, they're also informal caregivers for their family members. And some of these persons may have health challenges, thus placing them at a higher risk for contracting COVID-19. The National Assistance Board was deemed as an essential service, and therefore it was remained open to provide care to elderly persons in the residential or transitional shelter, the homeless shelter, and the home care program. So for these programs, the staff ensure that residents and occupants had access to essential support and care, and that they were following up with their health and medication needs, since the maintenance of medication and health regime is very, very, and more so critical during this time. In the interest of safety also, we adopted and developed visitation policies and protocols at the facilities which were open to minimize the risk of contracting COVID-19 for workers as well as our clients. So at our residential facility, while visits were suspended by families, staff made sure that the needs, especially for independent living residents, that their daily needs were met. So for example, normally independent living persons would provide and cook their own meals, but staff made sure that if there was any, or families would assist where there were any gaps, that this need was met. Provision was also, more importantly, provision was also made for counseling for staff. Many of them, as I said, would have had dual roles as caregivers, caring for beneficiaries during the day, and then you are returning to your home. You're also maybe vulnerable yourself, having had health challenges. So there are solutions for both staff as well as the beneficiaries of our service. Just to sum up at this point is that COVID-19 has had an impact on older persons worldwide, and especially those with underlying health conditions and those living with dementia. Persons with dementia are at a greater risk of elder abuse as they are dependent on others to help them manage the disease. And ironically, even as they are dependent on others, and this dependency is increasing at this time, caregivers and persons in the community who would normally assist are also looking after their needs as well. So in the interest of self-preservation and adhering to the physical distancing and everything, and looking after their needs, then unintentionally, and Dr. Ramsay would have said from the beginning that very often the perpetrators of elder abuse are not even sometimes aware. So unintentionally, while you're looking after your needs and looking after your self-preservation, the needs of older persons are lapsing, and that making them more susceptible and vulnerable to elder abuse. And Dr. Belle would have mentioned this, and I would reinforce it in closing, is that the whole role of support, and more support for caregivers, and is therefore imperative that caregivers, whether they're formal or informal, are provided with the support to help them navigate through the COVID-19 pandemic, and where possible, contingency plans are put in place so that where gaps have developed, that we're likely to negatively impact the delivery of services, that we're able to close that gap. A very example of this in terms of contingency planning. Well, it is public knowledge that the National Assistance Board would have been impacted by COVID-19, having had a cluster here. Fortunately for us, the majority of our workers in the field, our home care workers, were not impacted, but they were able to continue to deliver services in the community even as the headquarters was closed. And that brought to light the need to have contingency planning. If more persons were impacted or more workers were impacted, what plan would there have been? And we need to develop plans, and an event like that needs are still being met, especially for vulnerable persons and persons living alone and persons with dementia. Because in the absence of closing those gaps and having those plans, then more persons are susceptible and vulnerable to elder abuse.
Thank you, Colleen from the NAC. Very good information there as well. We are definitely going to come back to the question of support groups. It's a popular question in the chat. But before we get there, let's hear from Pamelia, Brereton, president of the Barbados Alzheimer's Association. Certainly that's one of the support groups on island with regards to dementia, persons with dementia and their carers. So Pamelia, over to you.
Okay, thank you, Kimberley. First of all, let me say I am so pleased with what is happening in Barbados in terms of the homes that had shut early. They were not taking in any more patients. And as you know, overseas, there were so many deaths and so on from various nursing homes. And I'm very pleased to say that I don't believe we've had any of that in Barbados. And for that, I have to applaud whoever was responsible for making sure that happened. And I hope it continues to be as safe as we still feel in Barbados with the lower numbers that we have. I know the region itself, we've had a large group compared to our number and the sizes of our communities and so on, but our numbers are not anything like what is happening in the larger countries. So let's try to maintain that. Now, I'm going to be very brief because the time is very short, and I know people want to get in their questions, but I will tell you a bit about what is happening with the with our organization. we are surviving. Let's put it that way. In order to maintain a good association, you need lots of money to do it. And that has not been forthcoming due to economics of various companies and so on. But we will continue to struggle and continue to fight, because for most of you that have heard me spoke before, this association is my heart, because there were so many people in my family that had the disease, and I feel that I have to stand up and fight for them and for others out there as well. Now, in terms of the association itself, we are looking at a number of things to happen. I cannot tell you what will happen for 2020. Most of you know that we do have an annual seminar, but that may not be possible due to what is happening with COVID-19. But we are looking forward to 2021, because we are looking at the regional conference in Barbados, and that does not just mean the English Caribbean region. We're looking at the French as well as the Spanish region to join us in May 2021. Alzheimer's Disease International already knows about that, because it was decided in Jamaica when we attend a workshop there with others, the other members of the various organizations as well. And I know a number of them are on the phone, probably waiting to get their questions in. We're also looking at a number of folks who have contacted me from overseas that have an interest in helping us in terms of finances. Some of them are planning on raising funds for us. I know the calls came in from the States and calls came in from Canada that would like very much to assist the association, and for that we appreciate it. We have a number of homes here that we work with very closely. Again, that goes back to say that I'm so pleased with some of the nursing homes and the way they have worked with the patients and so on. So again, I take my hat off to that, to them. Now, when persons call me in terms of abuse, I cannot do anything. The association cannot do anything. So what I would do, and Colleen would tell you, I call her, because they're the National Assistance Board. So people would call me and say, well, I call and I don't know what to do. So I have to keep referring them back to the NAB. This body's being thrown out, that body's being thrown out, their pension checks are being taken, you know, and it goes on and on and on and on. And this is not just Barbados, this is a worldwide thing. It's happening everywhere. I remember once there was a lady who came to see me, and her biggest thing was, could you help me to tell me how I can get into my grandfather's account? Now, apparently she was looking after granddad, but there's no way I could tell her what. I mean, even if I knew what to do, I had to tell her, look, you go and see a lawyer and get your family together and get things sorted out so that you can organize your life and your granddad's life. So I'm going to pause because it's almost 11:30. I'm going to stop here. So any questions that you have, let's just go ahead, Kimberly, and leave it like that.
Okay, thank you, Pamelia. Thank you to all of our panelists, and thank you to our attendees for your questions. I'm going to try to do this systematically. So we're going to start off with questions dealing with elder abuse. And there are a few of them in the chat. Dr. Ramsay and Dr. Belle, I think this is one that you both mentioned and that you can tackle. The question reads, could you elaborate further on the matter of not knowing what you are perpetuating elder abuse? Could you give some examples of that, please? I believe both of you would have mentioned that. Could either of you please elaborate? Someone in that situation who is not aware that they're actually abusing the person that they're caring for. Could you give us some specific examples? Dr. Belle, Dr. Ramsay? Just unmute your mics. Yeah.
Yes, I would like to defer that to Dr. Belle. Dr. Belle gave quite a few examples in her presentation. So Dr. Belle?
Okay, well, I did give the example of the situation of persons who were still up and about and active but elderly and ended up in settings where other people could not appreciate that they were not able to be as swift and as efficient in what they were doing as they would like, so that they could get through their own business. So that was one example that I gave. Apart from that, very often, the situation of you work, You come home, you see the cat at the door, you kick the cat, and the cat goes and the dog then turns around, bites somebody who's in the house already. This is a kind of ripple effect. And what many people who are caregivers particularly don't understand is that they need time out. They need to be able to relieve themselves of the pressure of looking after someone and putting in the kinds of mental and physical effort that they have to do to manage somebody with an early cognitive dysfunctional situation. Those people can be very, very obnoxious because they don't realize that they have a problem. And the ones who are really dementia, where they have to literally do almost everything for them every minute of the day. And behaviors as caregivers without realizing how drastic it is and how it is impacting on the persons who are in and who are elderly and needing assistance. So I think I'll leave it there in the interest of time.
Yes, thank you very much. We have another question here. How do you help older persons understand that you're trying to protect them from harm or danger? They may still feel that they're able to do their normal activities. What's the best way about going about that? Dr. Belle, perhaps Ms. Walcott as well, maybe you guys came across that in your training of persons who go into the homes. Could one of you please respond to that question? Just unmute your mic to speak, to respond.
Okay, I suppose I'll feel that one again then.
Mm-hmm.
This is a situation where I always say that you have to be creative because no two people are alike. So you can't have a plaster that is going to work for the sore in each person's situation. Feel that because you're asking them to wash their hands over and over again, that you are putting unnecessary pressure. Have had their lives, they have done things the way they've done them, and all of a sudden you're pressuring them to do it differently. So obviously there's going to be some opposition and some, why are you pushing me around, why are you ordering me around? You might even touch them, but it is the way in which you are going about how you do what you do. And they often, if you want somebody to do an action, or if you want somebody to participate in something with them, you do it with them. You don't order them, you don't tell them you must do. Don't you understand that you better wash your hands because you're going to dead if you don't wash your hands? You're going to have to be able to say to them, hi, I'm washing my hands now. Do you want to come and wash yours at the same time? Or let me wash one of your hands and you wash one of mine. And you get into dealing with situations where you can encourage and coax people to do things in the way that you want them to do and carry out those very difficult situations now with COVID that you have to do. Wearing a mask is really not something that anybody will normally want to do. And to have an elderly person suddenly have somebody fit something over their ears and push it down on their nose and push their glasses on top, it's very difficult. And so you have to appreciate that everybody gets frustrated, but the caregivers have to be the ones to contain themselves and give to those who can't help themselves.
If I may,
If I can add to that as well, very often, and it's difficult. Now, Dr. Belle says you're dealing with behaviors. You're dealing with older persons who would have had a sense of independence and understanding that roles have changed now, and they have to relinquish some roles, and it's quite difficult. But very often, sometimes as caregivers, we have to, because we have to manage the situation, is that we have to look at very often not only at the behavior of the person we are caring for or client, but very often at our behaviors as well. How are we going about this? I know sometimes for caregivers, especially informal caregivers at home, you're so emotionally involved in the care. The formal caregiver can step back, I can take a day off from work, I can call in, I can go on vacation. The informal caregiver is always there and emotionally involved, and there may be a lot of underlying issues and so on, family issues that you have to deal with. So sometimes we have to look at our behaviors. How are we encouraging persons? How are we motivating persons? In our frustrations, are we shouting? The way we are saying things, sometimes we may just have to step back from step back from a situation, if there's another person in the family that can do it better, or that has a better relationship with the person that you are caring for and who has more influence, maybe a granddaughter, favorite granddaughter, a child, whatever. I know sometimes we don't like to do that, but sometimes we have to ask for help, and we have to look at our behaviors and how are we getting the message over. And very often it's not always the message that we are giving the person, but the tone in which we're giving that message.
I would like to add to that as well, very quickly, that by watching Dr. Ryan's video, one of the things that she came up with, a simple little task like washing of hands for persons with dementia. You have to remember that person with dementia is a memory loss. So therefore, when it comes to washing their hands, they may not like the water. But then you have to think, well, what should I do here next? And one of the things she did suggest was a person with dementia, remember, think of a scent. For instance, if that person like lavender, you find a soap with lavender, and that might encourage them to be able to wash their hands. So that's just a small portion about, again, as Dr. Belle said, it's about creativity. Creativity is about creativity all through when it comes to person with dementia, because no two people are alike when it comes to dementia. The key thing is to remember what that person was like before and what they used to do, and then you take it from there.
Thank you. I'm going to merge these questions that we have together a bit. So we had a couple questions talking about what support groups are there. We discussed some of them during the presentation, but I want the panel to probably give a sense as to, this is another question that came in, what can service clubs do? Service clubs that already exist, what can they do to help elderly members in the community? Is there an opportunity for them to become some of these support groups in addition to the Barbados Alzheimer's Association, in addition to what the NAB has been doing? Could we have a response on that from?
Absolutely. I believe it can be. I've already spoken to a few of the support groups already. And I'm also trying to get the churches involved, because everybody in Barbados meets in the church. Everybody goes to church on Sunday, especially the elderly people. They're always in the church. And I think that's one of the best places to get support groups going. One thing that we were doing is trying to get them to come out in the evenings. And a lot of people say to us, well, it's so late. I can't leave mom and dad at 5 o'clock in the afternoon. I cannot drive at night. And these are the issues that we were having, trying to get people to come out to the support groups. And that's why we turn to churches. And yes, to those other groups out there, we are talking to a few of you about getting involved with the support groups for Barbados.
Thank you, Pamelia. Chris, I believe this is one for you. It came up during your presentation about the difference between the ages you would have mentioned, biological age and chronological age. Could you just elaborate on that a bit more?
Yeah, of course. It's a really interesting question, because I think that the governmental responses around the world with COVID have tended to be very age specific. It was just convenient to say that everybody over the age of 65 or 70 or 75 should shield or should isolate because they were perceived as a high-risk group. But what very quickly came out of that was this understanding that people's chronological age, the number of years that they've reached, is very different to their biological age in terms of their genetic makeup, their health, their lifestyle, their diet. So you may find somebody at 75 or 80 who is still in full-time employment, is the main driver of a vehicle for the family, who is fully functioning and out and about. And you may have somebody in their 40s with multiple comorbidities or non-communicable diseases that is much more at risk than that person that's 80. So it was really important to start to get some nuance into those conversations with governments and with healthcare systems. And I think one of the things that came out of it was a realization that there could not be an ongoing request for people over the age of, for example, 70 to continue to shield. And I know it's still very sensitive in some countries, that because some governments are still trying to enforce it.
Thank you, Chris. This is another one for you. It's regarding the dementia plans. So for countries that you have touted as successful stories having their dementia plans, have there been any monitoring and evaluation of those plans, the effectiveness of those plans?
Yeah, again, great question. And there have been a number of countries that have, they're onto plan 3 or even plan 4. What most of them suffered from early on was that monitoring wasn't particularly well put in place, but has subsequently become so. I think a few that I put up on the presentation, I identified Scotland and South Korea. I think Scotland's about to go into its 4th plan. South Korea is between its 3rd and its 4th plan. Both monitor very carefully now, and some of it's not very palatable. As an example, in Scotland, they put in place what was the world's first post-diagnostic guarantee, which genuinely meant by law, everybody following a diagnosis was guaranteed a certain level of support. When they started to measure that, they realized that only about 40% of people were actually able to get that support. No, so there was a realization that monitoring was key. And other key elements to that monitoring are really, we say it's simple things like diagnosis rates, like prevalence rates, incidence rates. They actually can be quite hard to do and quite hard to achieve, but without them, it's really difficult to monitor the plan's effectiveness.
Thank you. So we have another question coming in. It's a very interesting one. Pamelia, this is one that we would have discussed before, the importance of it. Do carers in private nursing homes undertake specialist dementia training? I think something like that would go a long way in helping to prevent abuse in homes. Colleen, is that something that you can answer from the NAB?
I can take on that for a bit, because if that's all right. There are a number of trained, even Dr. Ramsay can tell you, a number of trained nurses who have gone through the dementia programs abroad. So there are trained nurses in Barbados with the experience and the knowledge of working with dementia. Now, in terms of the auxiliary nurses, I am not too sure how extended programs are. I've gone into quite a few of the institutions where I spoke, but not as a lecturer, but advice. And I do feel that more training is necessary, because a lot of them too are not just working in institutions, they're going into private homes. And unless you are able and trained properly to tackle a person with dementia, you have a big problem on your hand. And it is very critical. It's unless someone can tell me otherwise, I cannot think of anybody else out there that have the correct training for auxiliary when it comes to care staff. If there is, please let me know.
In terms of the entry-level requirement for our workers in the community, that again is the auxiliary training. I don't know, as Pamelia said, the extent to which there's a component relating specifically to persons with dementia. However, wherever opportunities present themselves for further training for our workers in terms of the education and raising awareness, I know every year, once the Alzheimer's Association is sponsoring their seminar, the National Sisters Board makes sure that a number of our workers are exposed to that training. And as I said, it raises the awareness, exposing persons to the behaviors which persons with dementia will manifest, and how to deal with some of that. In terms of specialist training, no.
Colleen, I have gone into the National Assistance Board on a number of occasions every year, I believe. For the past 2 years, I haven't been there, where I gave sessions and took in videos and so on with your staff members, if you recall. So I don't know when you can invite me back. I really used to enjoy that. And this is how a lot of them, got their knowledge, because some of them sometimes will say to me, I've gone into somebody's home and they were saying I stole this and I stole that. And when it gets like that, nobody wants to go back to work. they don't want to go back to that particular house.
Yeah.
But yes, you did have some exposure within the National Assistance Board.
All right.
Thank you.
Yeah, I would like to comment here as well. Yes, the most programs that train auxiliaries will expose them to dementia. However, dementia requires a lot of the actual, dealing with persons and correctly comes down to training, practice, and this is where Ms. Brereton, Alzheimer's Association, I think, has been very helpful in, identifying examples of particular situations and how to deal with them. Every patient is different, and they will have specific, expressions and specific nuances. So each person will require the appropriate approach that works for them. Now, after I completed my training in, medicine, and then my postgraduate training in geriatric medicine, and I would have studied dementia, the different types. But when it came down to actually trying to deal with patients who and their caregivers who were dealing with the problems that presented themselves, it was difficult for me to help them to understand how to go about, preventing somebody, dealing with someone who's gonna get up in the middle of the night and maybe go outside, someone who may, in the middle of the day become agitated, outside of prescribing a drug and also talking about the different non-drug interventions that can be put in place. Practice really makes a difference. I would have, after my training, I would have been able to read a practical text that was produced by the, I think, Foundation for Health and Aging out of the United States. And it had some very practical approaches to older persons with different illnesses. And when I read Dementia, I was like, wow, I had a completely different approach, a different view of what, let's say, the caregivers were going through. And it helped me then to be able to, I still couldn't solve all their problems, but it helped me to be able to help them to look at things differently. And I often refer back to the Alzheimer's Association, which, through our link with ADI, has lots of resources that can be shared with these caregivers.
Definitely. Well said, Dr. Ramsay. Couldn't agree more. We're going to try to wrap it up because our panelists, some of them have to go offline and head back to their jobs, fighting for the elderly in their respective spheres. And I just want to close with just one last question. Hopefully we have attended to all of the questions, if not individually, but combined. But it's something that came up during the presentations. How can we involve older persons more in policies that concern them, in matters that concern them? And I think for sure, Chris, this is something that you mentioned, Colleen, you mentioned it as well, and Pamelia, you as well. So panelists, just want you to answer that question, and then I'm going to invite you to do your 1-minute takeaways, just really quickly, from this very informative discussion.
I grew up in a country called Canada, and within that country, people are taught to fight for their rights. And in Barbados, I don't think we speak up enough as to what is relevant to our lives. I've been living back here now for quite some time, very happily living back here. I'm proud to be back here as a Barbadian. But I do feel that Bajans need to get more involved with each other in terms of care, in terms of being able to speak up for what's important. The material things are not important, but health is one of them that is vital. And we need to be able to get up and speak about what is the most important, what's bothering us, what's keeping us down. Those are the issues that I feel that are very important.
Would anyone else like to have a go?
In terms of involving elderly persons more, and this is something that we always push for, individually, a lot of elderly persons, sometimes depending on their socioeconomic circumstances and other factors, do not necessarily have a voice individually. Sometimes the voices which are more strident are the ones that are heard, and it will come from like organized groups. And already we are seeing this in Barbados, where organized groups and groups organized, say, for the elderly, are making themselves heard and are having some input and into policies and decision making. But we have to help create those opportunities as well, particularly for our clients who may be very, very vulnerable. Sometimes we have to do this indirectly, whether it is through advocacy, through our social workers advocating on behalf of their clients. So there'll be various ways in which it can be done, whether it is through organized groups or persons with influence, such as social workers and social workers group, are advocating on behalf of their clients who may otherwise be voiceless.
I'm happy to jump in there as well. I think it's really vital to have mechanisms where both people who are living with dementia and their carers and elderly people are asked to participate in decision making. And if I can tie it back to the creation of a dementia plan as well, when government is consulting with healthcare professionals and the geriatricians, gerontologists, neurologists, really genuinely need the voice of people with dementia and their carers at that table as well, to give the lived experience, and to normalize the language. I think that's true pretty much of all disease groups, and I know our colleagues in the non-communicable disease sector are quite good at this as well, at getting people together to raise those voices. And then perhaps underpinning it from a rights point of view, there is a group that's been meeting for 11 years now, I believe, at the UN, which is the Open-Ended Working Group on Aging. And they are desperately trying to get to a point of the creation of a declaration for aging rights. And we do need something like this. I know that countries, all member states of the WHO and the UN, are not all in favour of it. But I think we have to position it in such a way that the contribution and integral membership of society by everybody, regardless of age, is taken into account. And I think with something like that declaration, we could really start to make some progress.
Great, thank you. We still have some questions pouring in, but we do have to wrap it up as some of our panelists have to go. But rest assured, we have social media outlets. We can continue to answer these offline and provide answers for you on those outlets. There are questions about what more can be done in the homes concerning the elderly, and questions about PPE equipment. But we will address those questions offline and seek to provide answers for you on the social media platforms that are available. So right now, I just want to thank the audience, thank the panelists. Panelists, I want to give you just 1 minute to wrap up, give the audience your key takeaway. Chris, there's one in the chat for you. Someone wants you to repeat that poignant quote that you gave. So I don't know if you can accomplish that in your 1 minute takeaway, but let's do that. I'm going to start with Colleen, with you from the NAB, and then we're just going to keep rolling.
In terms of my takeaway, the context and the environment is fluid, it's dynamic, and it is changing. The issues, they exacerbate the issues as it relates to older persons and elder abuse. And just as the context and the environment is changing, sometimes we have to look at fresh approaches and more creative approaches to really impact on the persons whom we are delivering services to.
Pamelia, you can jump in there next, just 1 minute.
Yes, I can. I believe elderly people should be living the rest of their lives in peace. They should be comfortable. There should be lots of love and respect. I also think that persons working in care homes and care facilities should be properly trained. For some people, these are just jobs. But I believe one should have love for what they're doing. If you have love for what you're doing, you can get through it, and you yourself will feel a lot better about yourself, as well as caring for the persons that you're caring for. If you have a problem, please remember you can give me a call. I can give my number right now. It's 418-0741, and I'll be happy to answer. I do that every day. I get at least 5 or 6 calls a day. So please don't be afraid to call. Thanks.
Thank you. Chris, we're going to go to you next. 1 minute.
Great. So the quote from Kate Swaffer from Dementia Alliance International, who is living with dementia, she said, in 2020, the rest of the world suddenly experienced what people with dementia and their families experience on a daily basis after diagnosis, such as isolation, distancing from many family and friends, fear, anxiety, and stigma. A really powerful quote. I think my takeaway today is twofold. One, from the perspective of Barbados itself, the COVID response there has been, in global terms, very successful. And I think we need to use that as a case study alongside countries like New Zealand, where there has been an efficient control and communication and transparency. So if I could take that out of this in a time that is incredibly difficult for most people, and for many countries that are going through real difficulties, there are some success stories.
Thank you. Dr. Ambrose. Ramsay, please, your 1 minute takeaway from this discussion.
Yes, well, my 1 minute takeaway, yes, we've done, very well in containing this disease, but dementia, COVID, and elder abuse, they all together can be seen as a perfect storm, which can result in decline and the demise of our older persons. We really need to work together in identifying, ways of mitigating the storm, so that, older persons can still continue to have a good quality of life.
Thank you. And Dr. Belle has had to leave us, and so we will try to get her takeaway to post on the Barbados Alzheimer's page later on. But thank you to our panelists. Before we go, I just want to share with you a quick challenge. As I mentioned, Elder Abuse Awareness Day is Monday, and this is just something that you can do amongst your families. Hopefully you can see the screen, but we are encouraging you to plant a tree, plant some kind of plant, and the theme is Uproot Elder Abuse, plant a seed for change. And I hope that every single person online, those who will watch later as well, can certainly engage in that activity. Take photos of yourself, of your family doing this activity, and certainly post them on social media. You can use the hashtags that are on the screen. And of course, purple is the color for World Elder Abuse Awareness, and we invite you as well to wear purple. And so with that, I would like to close the discussion. I have on the screen just some contact information. Persons have been asking, where can I get support? Where can I get support? Certainly the Barbados Alzheimer's is one association that's doing a lot of work on the ground, trying to support those with dementia in particular, and with Alzheimer's. And of course, there's the NAB contact. Do reach out. And as well, I invite you to report elder abuse. If you see it, speak out about it, talk about it, report it. And on my end, I do offer report writing services for those who are having difficulty putting their words down on paper, who want to report elder abuse. The information is at the bottom, and I invite you to do that. So there's nothing much left for me to say except thank you. Thank you to our panelists. Thank you so much for your enlightening presentations. Thank you to our audience. You've been great for your questions. I know we have a few that are still unanswered, but we will respond to those on social media. Thank you all.